Hello, this is Dr. Moyer discussing healthcare in the United States for the disadvantaged family class. You had an assignment this week to watch the Sick Around the World video and then answer some discussion questions about that. And that I have you do that video because it shows you how healthcare is handled in some other countries. Excuse me, which helps you to kind of really visualize and to compare and contrast the United States with other countries' healthcare systems. So, this statistic is the last that I can find before the Affordable Care Act went into effect hardcore this year. Hardcore meaning they started making people pay penalties if they don't have any health insurance, and they're in a category or income category where the government deems that they should be able to afford insurance. I realize that can be frustrating, being told what you should be able to afford, but that's how the Affordable Care Act is set up. It is trying to make sure that everybody has health insurance and that low-cost health insurance options are offered, and then people that can't afford it, according to the formula that the government has figured out, are able to access Medicare or Medicaid. Actually, it's Medicaid in their state, and each state decides what that formula is. So it's not consistent across states, which is one of the problems. But that is where we're at now. Some more statistics. The loss of productivity of uninsured Americans cost $130 billion annually. And it's actually less expensive if the government just insured everybody, much like other countries have figured out how to do. 3/4 of the uninsured don't qualify for public coverage, so Medicaid, Medicare. So they don't have any other option. If they can't get it through their employer, which is the number one way that people do obtain insurance, health insurance in the United States, and they don't qualify for Medicaid, then they're in a quandary. And that's that gap that the Affordable Care Act sought to fix or close. 8 in 10 uninsured Americans are from working families. So surprisingly, we are actually talking about people that work full time. But that may be the case that the employer didn't offer health benefits, or the employee is not eligible. Maybe they don't work enough hours. They have to work they have to be considered full time for most places. Or the employee has the option but just can't afford it because they're trying to stretch their paycheck to cover other things. Who is at the greatest risk? Well, young adults between the ages of 19 and 34. They are the group that is most likely to be uninsured. Why? One of the number one reasons that people in this age group list is the high cost. They also list job-related reasons. They lost a job, changed a job, only work part-time, and they don't have any access to employer-sponsored coverage. Or they've lost eligibility for public coverage, like Medicaid, due to working. They no longer can access that. They are ineligible due to their age, leaving, or graduating college. This was before the Affordable Care Act. Students could get cut off before they'd even graduated college from their parents' healthcare insurance, which was a big problem. But now the age has been extended through the Affordable Care Act so that it actually is capturing more college students. And then, of course, particularly for the younger part of this age group, the sense of invincibility. So I don't need insurance, nothing's going to happen. It's not uncommon for adolescents, which lasts into the early 20s, to feel invincible and think nothing's going to happen. And statistically, it's not this age group that is sick a lot or hurt. And so they have some science to back that up. But when it does happen, it can be devastating, and it can cause people to have to go sell everything they have and go into bankruptcy to pay for their healthcare bills. So what programs do we have? Well, we do actually have some programs, but not everybody's eligible. Medicaid is free or low-cost health care and long-term care coverage to certain categories of low-income Americans. Oftentimes, people that are not working, mainly parents with children, although the parents don't always qualify, but the children do. Interestingly enough, that's another kind of problem, caveat. Medicare, free or low-cost health care and long-term care coverage for people over the age of 65, but also for younger people that have been diagnosed with some type of disability, a permanent disability. SSI benefits or supplemental security income. You become automatically eligible for Medicaid if you receive SSI benefits, which is an income policy that gives mainly people with a documented disability some type of income on a regular basis. They can't work. They have to prove they can't work to be eligible for SSI. And then there are 11 states that have restricted access when it comes to Medicaid and SSI. And then each state has a children's health insurance program. So literally, and I'm not using literally figuratively, but literally, every child should have access to health insurance. So if the family can't afford it, then there's this free or very low-cost health care for uninsured children that are not eligible for Medicaid, and every state has their own version of it. So in Illinois, it's called the State Children's Health Insurance Program, or SHIP, but it'll have different names in different states. And basically, it just captures those children that can't qualify for Medicaid, but their parents can't afford any type of health insurance, so that all children have access to health care. Hopefully that made sense. What do people do when they don't have health insurance? Unfortunately, and this is why it's such a big problem and why we've passed the Affordable Care Act. It may not be the ideal policy, but it's a beginning, and oftentimes we have to start somewhere, because people go without their prescriptions. They go without recommended medical tests or treatment. They go without checkups. So a lot of this is preventative care, and it is actually much more inexpensive if we catch things early and treat them early, and control disease with prescriptions and treatment, rather than letting, what's the word I'm looking for, side effects occur or other problems to occur as a result of the original disease. People have to pay up front before services are rendered when they don't have health insurance, so they can be turned away if they don't have the money unless it's a life-threatening circumstance. So say you need a knee replacement surgery, it's not considered life-threatening, you don't have the money or insurance, you can't afford it, you're just going to have to go without it until you can save enough money to pay up front. And that can be a lot of money. We're talking tens of thousands of dollars. People that don't have health insurance end up hospitalized for things that are avoidable and controllable. Lots of diseases that are controlled with prescription and with treatment, with eating certain meal plans and following doctor instructions. They can't, or they won't. If they don't have health insurance, they can't. Then they end up in the hospital, and that costs a whole lot more than just being able to insure people in the first place. And then they die. There are at least 18,000 deaths every year among people that are uninsured that could have been prevented if they'd had health insurance. And that is the sobering fact of the condition of healthcare in the United States. I know that's not really a happy thought to end with, but that is a reality, and that's why we have to have something. So coverage matters. At the individual level costs, compared to people with insurance, children and adults without insurance experience poor health or worse health and die sooner, suffer emotionally and financially when even one member of the family is uninsured. So say the children are insured, but the mom isn't. I mean, that's still a problem. And children can experience developmental deficiencies if they don't have access to health care. At the societal level, all of society suffers when Americans are uninsured. There's diminished public health, higher public program and insurance costs for those that can afford it, and higher levels of poverty. So it costs all of us when people are not insured. And you will learn that in the Sick Around the World video, that many countries are much better off at thinking at the community level and how if anyone's poor, we're all affected, we're all hurt. If people don't have what most countries consider basic human right of healthcare, then everybody loses. So it's actually better to insure everybody. And that concludes this lecture on healthcare. I did just want to point out to you real quick that under content, and then under lectures, did I load it? Darn it, I didn't, but I'm going to do it right now. I'm going to upload the file for the Affordable Care Act. This is the wrong class. You say I have a million files. Been teaching a long time. Okay, Affordable Care Act. This is just a handout that gives you kind of a quick overview of the Affordable Care Act so that you can just get, a snapshot of what's there. And at the bottom of the handout, you'll see that I've given you more links so that you can do your own research. But under the new plan, by the time this plan is completely implemented, 95% of Americans will have health insurance, and that is the goal. And there's a lot of misconceptions about businesses, small businesses, large businesses, and there's a lot of misconceptions about just the whole act. So I encourage you to read about it. There are pros and cons to it. I feel that some of it is good and great, and I feel that other parts of it are not so great, and that we still have work to do. But, with public policy, that's how it works. We have to start somewhere, and we create a policy, and then we revise until we get it where we need it to be. So it's accomplishing what it's set out to do. Okay, that's all. Hope you enjoyed it.